afternoon. Thanks for joining the Superior Health Quality Alliance Roundtable conversation. My name's Kim Heft, and I'm joined by my colleagues. I have Elena Baer, Kelsey Ostergren, and Jerry Hineker here with me today. For those that have been joining us, welcome back again. If you're new to this call, we're very glad to have you here. We host this session each week. It consists of a 30-minute educational session where we highlight important topics related to COVID-19 vaccinations, their boosters, and other nursing home topics. There's going to be a survey at the end of the session, which we would just love for you to fill out for us. And the PowerPoint presentation is going to be in chat momentarily. Please use that chat box to share any comments, questions, anything that pops up in your mind during the presentation. Today, though, we're going to run things a little bit differently today. We're going to ask for your input on a few items during our presentation instead of doing it all at the end. So put your thinking caps on and be ready to give us your ideas. So today's topic is fostering an immunization culture. High vaccination rates, they cannot be maintained with one-time or short-term efforts. A greater understanding of strategies to increase and sustain vaccination is necessary to create lasting and effective immunization delivery systems. So by creating a culture of immunization within your nursing home that plays a critical role in maintaining and increasing the vaccination rates, as well as ensuring that vaccines are delivered safely, effectively, and on time. So our objectives for today, we are going to review the meaning of culture and how it applies to immunizations. We're going to learn how to foster this immunization culture, and we're going to describe how technology can be useful to promote a positive immunization culture. But before we get started, we have a few polling questions for the audience. And the first one is, how effective is your current immunization program? So how do you feel about that? The effectiveness, do you think it is effective, somewhat effective, or not effective? Oh, and I see right on the second one too, not realizing they're on here together. Thanks, Elena. How effective is your infection control program? And the third one is, do you think the immunization and the infection control programs complement each other? I'll give everyone just a minute to answer this. So the current immunization program almost have a 50-50, right, on effective and somewhat effective. Your infection control program, I love this, right? Effectiveness, 82%, somewhat effective at 18%. Really glad to see that no one has picked not effective, right? That's just excellent. And then, of course, do you think the immunization and infection control programs, do they complement each other? And I added that, we added that on there about yes or no, do you think they complement each other? Basically, just due to the fact that if you have a strong immunization program, the likelihood of different, now not everything is of course stopped by a vaccine, but the likelihood of certain infections coming into your building, getting people sick are much less going to happen, right? If you have a culture of immunization where most of the people are immunized for the various diseases out there. So I'm glad to see that most everybody's on the same page. Perfect. All right. I think, Elena, tell us a little bit about what an organizational culture is.
Yeah, thanks, Kim. Thanks for getting us started. So if you were to look up what a culture is, there are so many different definitions out there, but this one I felt like got really very basic here is how culture is how organizations do things. Now, I've also seen some other ones that say it's the set of shared attitudes, values, goals, and practices that characterizes an institution or organization. But at the very basic level, it's just how you're doing things and how other people are seeing you do things, what your staff members know is the right thing to do based on what you've kind of laid out. It involves making sure that staff members are all on the same page and they convey the same messages and that they're really taking what you've laid out as your culture and living it. According to Forbes, a rich company culture can lead to innovation. So coming up with new ideas to make things more effective or efficient. Strong culture means better retention. So once you get people on board to your culture, they want to stay and continue to build your culture up and make it better because they really are believing what you're putting out there. And culture is a long-term commitment to excellence. It's not something you change overnight. I'm sure you are all well aware of that. But once you really dive deeply into making a culture shift, you're showing that long-term commitment. And then kind of, as I already mentioned, the right focus can mean greater efficiency. So what does it then mean to foster an immunization culture? This is when all staff members are knowledgeable about vaccination recommendations or they know who to ask. So as you all know, especially with the COVID-19 vaccines, things have changed with those so many times. We've seen the Pfizer vaccine coming out first, then Moderna was available, and they had slightly different differences in when you even got the second dose, for example. Then we got the Johnson & Johnson vaccine. And then more recently, we got the Novavax vaccine. We've had boosters come out. And then even more recently, now we're talking about this Omicron booster. It is incredibly difficult to keep track of all of that when you're also trying to do everything else that you're doing. So it's pretty difficult to assume that every staff member is going to know all of those details. If we can't get there, which is really, really difficult, we need to have someone on staff who really knows their stuff, who knows where to look to find the answers, a one-stop shop. And it's the person that everyone else on staff knows they know their stuff. So everyone is pretty knowledgeable, or they definitely know who to ask. We also want to make sure that staff members know the benefits of vaccines and can describe the burden of vaccine preventable diseases. So I know a few weeks ago we had some discussions about chronic disease management in some of our vaccines focused on influenza, pneumococcal, and COVID-19. So that would be a great thing to go back and look at to make sure that our staff members know what the benefits of vaccines are and also what could happen if we don't get those vaccines and the burden that those vaccine preventable diseases have on especially the populations that we're focused on. Another big one here is having consistent messaging about immunizations. This kind of goes along with what Andrea Becker talked about last week, just making sure that whether there's guidance for everyone about how to respond when someone asks a team member about getting vaccinated, or just some basic language that everyone can just follow. Another great way to use your immunization culture is signage throughout your building. I'll play a video a little while later that kind of talks about this, but that way your staff can see that it's almost immunization season, if it's coming up on flu season. Family members, residents, they see that we want to get our vaccines, that a flu vaccination is coming up. Having that throughout your building, changing it up every once in a while, so it's not just the poster that they walk by every single day. There's something new, there's something eye-catching. That's another great way to foster that immunization culture. And lastly, again, going back to what Andrea talked about last week, is using that presumptive style of recommendation. So this is an example of that. It's time for your next COVID booster. I recommend you get boosted today. My family and I are all boosted. It is the healthy thing to do. So rather than kind of making it more of a question of if they're going to get it, that it's more of that recommendation. It's more of that kind of expectation because you are fostering that immunization culture. And then finally, why is it important to foster a culture of immunization? At the basic level, it's to keep your staff and your residents safe. Now, remember, we know that vaccines help to prevent or reduce the severity of illness. So that's really why we want to foster this culture of immunization. In addition, it's going to help reduce confusion and build confidence. So among your residents, if your staff members are all giving the same having the same conversations with other staff or with residents, staff members and residents are going to start feeling more confident. They're going to say, okay, we have really decided that we are all going to get immunized. It's the right thing to do. I'm hearing this consistent messaging. There's nothing confusing coming out of my team members. I'm not hearing conflicting evidence or anything like that. And so I want to go get vaccinated. And then lastly, having a more efficient vaccination season. So just ensuring that everyone's on the same page, it will help you get your consent forms back on a more regular basis, making sure that family members are on board, staff members are on board, and residents are on board. So how do we foster an immunization culture? The first way we do so is by educating and motivating our staff members. Now, I'm sure that this is something that you have been so focused on over the past couple of years now. And I know at one of our recent calls, we talked about vaccine fatigue. Now, that is not just for the people that you are talking to about getting vaccinated. I'm sure some of you are feeling that on the education front, right? It is difficult to continue to talk about these things. And that's kind of where those motivational interviewing techniques that we've talked about in the past come into play. But that's also another great opportunity to kind of shift the focus and provide these trainings from different voices. You have all been doing so much to influence staff, to influence residents, and encourage them to stay healthy and get these vaccines. But there's a lot of great resources out there that we want to share with you that you could also send out to staff members so that they can get their education from other sources. One thing I do want to put out there though, and I think this is going to start changing because of COVID-19, is that a lot of the education that you will find out there is geared toward adolescent or childhood vaccinations. And that's just because they have to get a lot of those vaccines on a specific period of time. And so there's just so much education out there that's pretty catered to clinician offices, pediatrician offices, et cetera. But one thing we will say about that is that it can easily be used and the language can be slightly altered to be used towards a different age group. So if you see education out there that seems like it's more pediatric focused, don't shy away from it. Definitely take a peek at it because in a lot of ways, what they've been educating parents about for so many years can be shifted just slightly and used in different settings. And like I said, I think based on everything that has happened with COVID-19 in the coming years, we might find more of those resources that are geared toward adult populations. So here are some of those trainings that we're talking about. And one thing we just want to put out there and something I'd like to ask all of you about is, are you starting to prepare for your first influenza clinic, for giving out those first flu vaccines? So pop that in the chat. Let us know if you're starting to do anything for those. And if you are, what types of education are you giving for your staff right now? Our first recommendation would probably be to start doing some lunch and learns or having some huddles or something like that leading up to your first influenza clinic, just to kind of get everyone's messaging consistent and get everyone thinking about influenza clinics and what your team needs to have prepared to have a pretty efficient influenza season. Here are some of the tools that we want to share with everyone. The first one is how nurses and MAs can foster a culture of immunization in practice. This one is a CDC resource, and it does provide continued education credit, so highly suggest checking that one out. We also have our own Frontline Forces series. We've talked about these before, and we know that you are all big supporters of those, so thank you. We do have one on our website that's linked there, focused on vaccinations. So definitely check that out. I know there is one that is focused on influenza, so you can send that out to your team members, and there's a quiz attached to it. We're also working on more of those Frontline Forces modules that we will share with everyone as they come out. And then the next two here are, again, CDC resources that have some modules attached to them that you can use. So my other question is going to be, what do you do or use at your facility? So I see Stacy said assigning Frontline Forces vaccinations as your September mandatory education. Thank you so much, Stacy. We appreciate your support, and we always welcome feedback on those courses. So if you have suggestions for other courses, feel free to pop those in the chat as well, especially if they're any topic, but especially if there's something that you see your team is lacking when it comes to some education around immunizations. We'll give everyone a couple seconds. I want to see who's already started preparing for your influenza vaccine season. Or what types of things have you done in the past that have been really successful? Thanks, Tracy. My why for vaccinations. Team members fill out a sign to explain why they feel vaccination is important. I love that. That's a really great way to share vaccine stories, kind of share what their coworkers, why they want to get vaccinated. I think that's a really great way to do it. And it's personal. You know the people that you're reading that about. So that is awesome, Tracy. Yeah, team member support and peer support. Great idea. I love that. And do you hang those in places where family members might see them? Or are they in more of a staff lounge? Throughout the building and also on our company app. That's awesome. Very cool. Really makes it very visible. And that is a really great way to show that you're fostering that culture of immunization. Does anyone else have any ways that you're preparing for influenza season? All right. Well, if you think of anything throughout the whole presentation, feel free to pop it in there. Or if you have any questions, there's another one. Providing a vaccination clinic for team members, that's excellent as well. Make it easy for them. If it's right in the building, it's a lot easier than them having to schedule something themselves or go find it outside of the building. So that is a great idea as well. All right. So the next thing we have here is a quick video. This is less than a minute long, but it's going to kind of talk about how this specific clinician fosters a immunization culture. And let me make sure that I'm sharing my sound for you.
The way we foster a culture of vaccination within our practice is that we really start with a signage as soon as a patient steps in through the door. We have signs everywhere, and we also have our staff repeating the importance of vaccinations across the organization. So for example, if the person is going to the pharmacy, both the pharmacy technician and the pharmacist are talking about the importance of vaccine and reminding patients to become vaccinated. Our dentist also has that same message, our nutrition counselor, our lab workers, and then us personally, the clinicians, are also talking about how we get vaccinated and how we want to prevent our patients from having any issues.
Okay, so you can really see there, like I said, it's a pretty short, sweet video, but she talks about that signage right when you walk in the building. And she also talks about another important thing of making sure kind of everyone is on board. So her patients are hearing about vaccines from her, the clinician. They're hearing it from the pharmacist. They're hearing it from nutrition. They're hearing it from everyone. So I don't know, does everyone kind of have that same practice in place where kind of residents might hear that information from multiple different people throughout your building? Tracy popped another thing in the chat. She asked the medical director to address a personal letter of recommendation to express the importance of vaccination for team members, residents, and families. And that is another really, really great route. I know medical directors are a great source to have speak to your staff, your residents, your family members. And this is a really great way to get the word out to all of the above. So I think that's another really great idea. Thank you, Tracy. Mm-hmm. Okay. Up next, we have identifying vaccine champions. So again, like Kim mentioned, we're going to be asking you a lot of questions throughout this. So my first one is going to be, how many of you have already identified vaccine champions? It doesn't have to be for influenza vaccine. I know I've talked about that a little bit today, but maybe you've had some for COVID or just in general. Who here has, even if it's not something you still have, if you've ever identified vaccine champions, pop that in the chat for us because we want to talk about it.
Yeah, well,
oh, go ahead. Yeah.
While they're popping those messages into chat, yeah, I worked in a nursing home and we had 2 vaccine champions, but you know, at the time when COVID was first coming out, we didn't even identify them. Oh, those are our vaccine champions. It kind of just happened. One of them was the medical director, and she was very instrumental in promoting a positive culture and immunization of COVID-19. Now, she worked out very well. I mean, she's our medical director. She was doing one-on-ones. She was out and about and during, in the whole building, just spreading the word. And it was excellent. The other champion we had just kind of happened was an activities aide. She's I got to give you a little background on how she was so dynamic. She is actually of retirement age, but like tap dances for the residents on their birthday. She's all over the place, just da-da-da-da-da, but everybody loves her. They respect her opinions. And so she was out promoting the vaccination to everyone. What could we have done better though with her though, would be going back and looking at it, giving her more guidance, right? Reeling her in a little bit, not that she was doing a bad job, but like in giving her better tools and using her in different formats, not just in her own little like world of people that she communicates with. So I just want you to like think about those people, who they are and how you can tailor them to promote your culture that you want in your building.
Yes, thank you, Kim. I think that's a really great example. One thing I did just want to mention too. So, okay, Tracy wrote something in the chat for us. We assigned a vaccination ambassador at each community for another team member resource. Awesome. Tracy, what types of people did you select for that? Was it people that volunteered for it, or did you have to kind of ask someone to act in that role? And you can always feel free to unmute yourself too. I know we're asking, Tracy, thank you for all your comments here. And so we're asking you to have your fingers ready to type, but always feel more than welcome to unmute yourself. While Tracy's typing that out, has anyone tried Vaccine Champions but had it not work? Or it just wasn't very effective, or anything like that? We want to hear both sides of it, because not everything works out perfectly. Tracy mentions the roles varied, but we targeted someone in school that this could be linked to a project, so they were very motivated. That is an awesome idea, Tracy. And yeah, thank you so much for sharing that. I don't know, Kim, do you have any experience with that or any thoughts? Because Kim has worked, clearly, she's been boots on the ground during COVID even. So any thoughts? I don't think either of the people you referenced were in school or anything like that, but it was more the one they just noticed was automatically doing it. But I think this school option is really, really smart.
It's a cool idea. Yeah, I like it. I don't have nothing to add to it, but it's a really cool idea. Yes.
Anybody else? Has anyone else tested anything like this out? Or is there anything that holds you back from testing it out? You just don't think it'll be effective or anything like that? While you're thinking on that, one of the ways that we want to kind of encourage you to think about having Vaccine Champions is how to select not just one person, but kind of having a team of people. And this kind of depends too a little bit on the size of your organization and all of those things. But if you have this team, again, it will help kind of ensure that you have someone that acts in that champion role throughout different departments within your organization. So you can see here, we have select a team of people who are from different teams. So you could have someone from administration. Now, one thing that we'll talk about a little bit more is that this really needs to be something that the administration team has bought into. In general, fostering that immunization culture has to start at the top and continue to build as it goes down. So they really have to see that the administration team, that the leadership team is on board with this and are doing as much as they can to foster this immunization culture. So it has to be administration is going to play a role in this vaccine champion team. You have to have nurses, you have to have certified nurse assistants, and you have to have dietary all involved in this. Everyone from admin teams all the way down. You want to have people that are well respected in their teams. So people that you oftentimes see other team members go to ask questions already. Those are really great people to tap into for this champion role. People that are influential. So you kind of know those influencers in your buildings. Those are great people to tap for this role, to give them this job and empower them that this is something we really want to focus on because it's going to help save lives and keep people healthy. And then somebody that's confident, someone that is not going to shy away from having some of those difficult conversations. It's not always fun. There can be some really fun situations. I feel like, Tracy, you did a really great job explaining that it was someone in school, it was something that was linked to a project. So they were excited about it probably, and they knew that they really wanted to show how great they could do with this project. So this was something that they were confident about and wanted to do a good job at. But this isn't always going to be super fun work. It's difficult to influence people. It's difficult to change people's minds, but that's why you're selecting a really great person. You're tapping them on the shoulder and asking them if this is something that they want to do, or you might just have someone automatically that's really interested in this, that's been an influencer within your facility. You've seen them have those conversations and you ask them to take on this role. You also want to try to identify a lead champion if you have a team of champions. That way they can kind of move things forward. They're looking at, okay, influenza immunization season is coming up. What types of things do we need to be doing right now to ensure that we have a successful influenza immunization season? And as I mentioned, this team really needs to have full support from leadership, and then they need to have the tools to spread the culture. So I think this just did something a little funky. Let me see here. There we go. So how to be a vaccine champion. So if you identify someone who could be a potential champion, these resources could really help them understand the role. Again, they're all linked here, some really great ways to send this out to people. If you tap someone on the shoulder and they're like, oh, let me think about it. These are 3 really great resources that talk about that role as a champion. So definitely send these along to those people. But in addition to these resources, we have some roles here of vaccine champions. So these are going to be the people that encourage coworkers to get vaccinated. They're going to encourage residents, et cetera, all of the people on your team. And they're going to be that source of information for residents, family members, and staff members. So remember how I said it's really difficult to make sure that everyone knows everything. These are going to be the people who are really honed in on ensuring that they know about the vaccines, keeping up to date with them, understanding when things changes so that another staff member or a resident could come to them and ask questions.
Elena,
Yes.
Elena, I'm not seeing your, what slide are you on? Are you on slide 10?
Let me see. Let me make sure that you can see everything.
I just want to make sure.
Can you see it now? My computer is running really slow.
Okay. Yep. All
You can
right.
see it now?
I just want to double check that we were on the right page. Okay.
Thank you. Yes, thank you. So outside of that, they are going to help create guidelines for your immunization culture. So they're going to be the people that could help develop that consistent language, and they're going to use existing or create new posters to advertise immunization seasons. So they're really helping push everything forward. They can kind of help create bulletin boards to encourage vaccination, and they could even start some friendly competitions to improve vaccination rates. Maybe it's going to be your nursing staff versus your administration team, and you look at how many of those staff members get vaccinated in the month of October. And you kind of have those friendly competitions. So these are just some of the things that a vaccine champion could focus on. And then they keep staff updated, like we mentioned, bulletin boards, sending out text messages, sending out emails, mentioning when the next influenza, COVID, et cetera, clinic is coming up, so that they can get immunized for that. Your information is going to get disseminated through those vaccine champions, and you're going to want to share evidence-based resources. So CDC vaccine information for healthcare professionals. We have the Centers for Medicare and Medicaid Services, immunization and vaccine resources, and the Advisory Committee on Immunization Practices, or the ACIP. They meet regularly and have a lot of different work groups. And so they keep all of their recommendations on their website as well. So those are great resources to turn to and send out to your staff members. And then lastly, within this section is leading by example. So like we mentioned, the leadership team must believe in the culture and they have to live it as well. You've got to use the language. So you're working with your team members, your vaccine champions potentially, to develop the language, and you have to then use it. You have to empower those champions, let them know that you're there to support them, but you feel like you trust their guidance for the rest of the staff. You have to provide time, support, and resources, and make sure that everyone can see that you are living this new culture. And culture shifts are difficult and time consuming, but they are definitely achievable and worth it. The next thing in order to foster that immunization culture is capturing every opportunity to immunize. So the first step for that is assessing immunization status. So one thing that I've seen as I've talked with nursing homes over the past year or so is not everyone understands who is tracking immunizations within your facility. So in the past, I've worked with infection preventionists that are tracking that internally for residents, but they don't know who's putting that information into NHSN for them. And sometimes that can create barriers, especially if someone goes out unexpectedly on a leave or is sick, and these things need to get put into NHSN every single week. So making sure that your teams are aware of what that process really looks like. You might be tracking this internally on a spreadsheet, but for example, if we had Superior Health Nursing Center, I might be doing that, but then Kim is putting it into NHSN. And even better, trying to streamline that. We highly suggest having several people having access to NHSN and knowing how to use it, just in case someone does go out of on a leave or something like that unexpectedly. Also, ensuring staff members track immunizations appropriately so that no one is missed, making sure that that's going in the correct section of a patient's medical chart so that it's pulling correctly, that people know where to look for it, and all of that is really important. Knowing the immunization schedule and printing it out for staff members to reference. So this website right here will have that immunization schedule so that you can print it out and give it to staff members so that they know who is eligible for what, when, and then reviewing your state immunization registry. And I know we've talked about that during these calls as well. And then lastly, within this section is maximizing opportunities to vaccinate. So some of those ways that we can do that is we know that you are all incredibly busy with so many different things and you're dealing with staffing shortages. So we can always connect you with a mobile vaccination clinic that can help you out with providing vaccine. They don't cost any money to come out to your facility, but they can help out with that portion of things. We also suggest the co-administration of vaccines. Influenza and COVID-19 is a really great one to kind of knock out all at the same time. So we really suggest administering all needed or recommended eligible vaccines at the same time. So question in the chat, I know we're coming up for influenza season. For those of your staff members or residents who will be eligible for both the COVID-19 booster and the influenza immunization, will you be recommending co-administration, or do you already have plans in place to co-administer those vaccines? Let us know in the chat. Anybody? Have we not started thinking about it quite yet? Or did anyone co-administer vaccines at any other point in time? Did we start doing that last influenza season? All right, I'll give everyone a couple more seconds, but I want to start seeing some answers in there. So if you have done it, or if you plan to do it this year, just pop a yes or a no in that chat for us. Another thing we want to do to maximize those opportunities to vaccinate is drum up excitement about vaccination season. So create those posters, send regular emails or letters. A great example is what Tracy mentioned with her medical director. Talk about upcoming clinics regularly with residents and family members. Do all those things to drum up as much excitement as you probably can. I know it's not the most exciting thing in the world, but just making sure that people are aware that this is coming, that you have these vaccine clinics coming up. Make sure you get your vaccine. It's time to get your vaccine. Just really making sure that that messaging is consistent. It's coming out. It's reminding them. It's really hard to remember all of these things all the time. So just pushing that information out regularly is really, really helpful. All right, we're seeing some answers in here. Okay, Wendy says our pharmacist is not recommending this due to possible side effects and then not knowing for sure which one is causing the issue. Okay, and Vicky says we are not planning to co-administer at this time. Our influenza clinic is scheduled, but we have not prepared for the bivalent COVID vaccinations yet. Yeah, so I know those have just kind of came out. They were approved just recently. So I'm sure you're getting ready for those clinics as well. So thank you, all three of you. So we are doing a COVID vaccine clinic September 20th and the flu clinic the first week of October. Great. And do you think One of those is going to be more successful than the other. Have you already started getting consent for those and noticing any sort of people are really signing up for the COVID one or not so much the flu, or is everyone kind of signing up for both of those?
I just wanted to point out, though, in regards to the comment about the pharmacist recommendation on not doing the co-administration, I would just probably advise, though, that based on, I mean, as a organization, as a facility, though, that you are all, again, the consistent message. Is that going to be then the policy that you are holding with promoting your immunization program and your culture? Again, just being on the same page, no mixed messages. As soon as there's a mixed message, the trust just trickles away.
Great point, Kim. Yeah. And Jamie said that they're sending out consents today. That's awesome. Well, thank you all for letting us know what your plans are. That's really, really helpful. I like the idea of kind of, if it's not going to be co-administered, to have them pretty close together here. Like Jamie mentioned, September 20th, and then the first week of October. Just making sure that, and some of these, right, when we talk about maximizing opportunities to vaccinate, you have people that are staying long-term, a lot of them at your facilities, right? So again, a lot of what you will see education wise out on the internet that talks about maximizing these opportunities to vaccinate, again, goes back kind of to the pediatric populations where they're just coming in for one visit. Now, co-administration of vaccines, as we know, is approved, but whatever your medical director, pharmacist, et cetera, recommends is definitely your best bet. But like Kim said, just making sure that that is consistent to build that trust is really, really helpful. The last thing on this slide here is creating an efficient consent process so that all residents are ready to be immunized when you have your first clinic. So, you know, Jamie already mentioned that they're sending out consent forms today for their vaccine clinics, but just making sure that you have that really well laid out. So again, it builds the trust. People know when to expect those, and that it has all of the information that they might need on it as well. With that, I will pass this over to Kim.
All right. Yeah, let's talk a little bit about prioritizing the education and communication, and that is with staff, residents, and families. So let's start with, let's spread the message. You want to be out there and you want to say, we are pro-immunization. Share that nursing home philosophy and policies with your residents, your families, your staff. For your admissions, is your immunization policy or philosophy in your admission packet? Does the admitting nurse promote your philosophy? That admission period is like the optimal time because it brings everybody together, right? It's the key people. Everybody's paying attention to the residents. You got the resident, the family, medical records, nursing home staff, physicians that are responsible. So this is the time to promote that vaccination. And also, this is a great time to implement your systematic vaccination tools, such as your revolving consent forms. Do you have that for your annual influenza vaccine so that one-stop shopping, you sign it once, and then you are able to administer that influenza vaccine every year because you have the one consent? Are your standing orders also in place, which eliminates the need for your physicians to write individual orders for the vaccines? Resident council, are they up to date? Do they know about the new bivalent coming out? Do they know when the flu vaccines are going to be happening, when you're going to have those clinics? Are you handing out all that vaccine information so that they can go back and look at it and see if they have any questions? How about care conferences? Bring your consent forms to care conferences so that the families and the residents can sign them at Care Conference. And I highly suggest having some kind of vaccine champion during the Care Conference, that person that is comfortable, that feels good about talking about vaccinations when the family brings up questions. Your practitioner visits. Is vaccination part of the visit? So before they go into that resident's room, do they already know that, Mary Jones needs a pneumococcal today? And so that they can talk to the resident about that. For staff, you have interviews and onboarding. Tell everyone that you're pro-immunization, that is part of your culture. In your team meetings, okay, now this might sound a little crazy to some of you, but I did this before. Have you ever started your team meeting with your mission statement? And now this can be part of a larger strategy to build a positive work culture, but instead of that, change it up and start your meetings with your nursing home's immunization statement. You don't have one? Probably not, because I didn't have one either. But create one. But don't you create it. You got too much to do. Use your disciplines, including your residents, to create an immunization statement. Empower your staff. Make them part of the vision. You'll have a better chance of them climbing on board. Okay. Next slide, please. A strong recommendation by a healthcare provider is a powerful motivator for people to comply with vaccination. Even initially reluctant adults are likely to receive a vaccination when a healthcare provider's opinion of the vaccine is positive and they are considered the trusted resource. So trust in their recommendations is a major driver for vaccination uptake. So what does a trusted provider look like? Well, they have the expertise, they have fact-based evidence, they're unbiased, and they have the established process for sharing information. They use presumptive versus precipitory approach, right? I mean, actually, Elena already had outlined that. Actually, Andrea Becker did too. So huge on that presumptive versus precipitory approach. So who are these trusted individuals in your homes? I would actually say to drop that in chat, but we're going to move on and maybe we'll come back to that to see if we can identify who you think those people are going to be. Maybe they are your medical directors. And it's kind of like, not quite like a vaccine champion, but they could overlap possibly. It's just that trusted person that's going to make that person say, yes, I want to get vaccinated. Okay, next slide. Communicating the same vaccination message is important. You want to train your staff on how to address your basic vaccine questions. So you'll see this SHARE acronym here. So share the tailored reasons why the recommended vaccine is right for that resident based on their age, their health status, their lifestyle, any other risk factors. You want to reinforce that vaccines are safe and effective. Highlight positive experiences with vaccines. Maybe you have a personal experience, if it's appropriate, and reinforce the benefits and strengths. Reinforce, I should say, the benefits and strengthen confidence in vaccination. Address residents' questions and concerns, including side effects, safety, vaccine effectiveness. Remind residents that vaccines protect them and their loved ones from many common and serious diseases. Explain the potential costs of getting disease, including serious health effects, lost time. When I say lost time and I think of residents, maybe it's enough for them that they can't leave their room because they're too sick and they can't go to activities or the dining room. Or maybe the family, they don't want to see the family because they're sick, and that would be a big loss for them. And also use the same training materials and have them handy for staff use. Not all staff are going to be giving these vaccinations, but everyone plays a role. Training dietary, maintenance, housekeeping, and so on is important so that they can also promote a consistent message. Now, educating residents and families and staff about immunization should be done in a culturally appropriate manner and in a language that is easy to understand. Provide handouts. Doing so gives residents and families time to read and understand the information, and then they're going to be able to come prepared and discuss their concerns. Maintain that ongoing communication. Provide education to residents and family about the importance of vaccines. Just going to keep them involved in maintaining that positive perspective. So, like, what does your 12-month calendar look like? Whether it's an in-service calendar or there's all sorts of different calendars I know that the administrators and DONs are using. But where does immunization really get a big push in your building? I'm sure you're going to say influenza, but like, did you know that August was immunization month? How is that promoted in your home? March 16th is National Vaccination Day. National Influenza Week is December 6th through 12th. There's even a World Pneumonia Day is November 12th. I just give these examples as different ways to motivate, create newer materials, get people thinking and putting this information out there instead of the same, I guess you could say, right, the same old every day where people aren't even looking at things anymore. Next slide, please. Okay, so let's make life easier and let's put technology to work for us. Okay, next slide. Electronic health records. It can be used as your tracking system, flagging those residents that the practitioners need to talk to about immunization during their visit. You can use your EHR to find out who's missing vaccines or who's missing doses. Generate reports for QAPI, for your quality measures. Use these reports to generate gaps in your processes. If you don't know how to access all of the software capabilities in your EHR, reach out to your vendor, set up learning opportunities. Most of your EHRs have a really good help desk somewhere. You're right on the screen. You can tell where mine used to be, right? Or ask IT or health information to assist in generating reports or learning about the capabilities of your health record. We talked a little bit before about standing orders. Do you have them for your immunizations? If you don't, vaccination may end up being delayed or even worse, never completed. And just going back a little bit about your electronic health record, who oversees your electronic health record? I think this is often an underutilized resource, and having key support is helpful. And I don't even just mean for immunizations, for many other things. If you have one person or couple of people that are overseeing the system, and I don't mean like IT oversee, people that are aware of healthcare, maybe it's a nurse or a staff development coordinator or somebody that is aware of new products, protocols, new reports, alerts, and so on and so forth that are displayed on your landing page or the dashboard of your electronic health record. Okay, next slide. So include the nursing home's vaccination philosophy and adult vaccination schedule on the home's website. Why not? Put it right there so that people understand that you are pro-immunization. How many computers do you have in your building? I came from a large building and there were computers and laptops all over the place. Put your pro-immunization materials on your screensavers and on your computers of laptops and so on and so forth. That is a big place that I think that would be great for immunization efforts. Of course, get HR involved, use Facebook, Twitter, other social media platforms to promote vaccination efforts. Your generations too are going to be a little bit different. If you're going to send out vaccination information to maybe the residents and the families, they're probably out on Facebook a lot. But, do you have your employees that are like ages 16 to 25-ish? I'm guessing those are your Generation Zs. They're not on Facebook. They're looking at all the information about immunization on Instagram probably, or Snapchat, or some of those other social media platforms that you may or may not be using. Okay, next slide. Your state immunization registries. So once you have access, you can obtain any resident vaccination records. So I do have a question here. This one I do want to know. I'm curious to know if things have changed or there is still an issue. Are you able to get vaccination records from your acute care settings, prior to that resident admission? Do you know the vaccination status from them from the from the hospital records? Or is that even mute? That doesn't even matter anymore because everything you want is found on your state registries. Could you give me an update on that, please? Okay. Thanks, Jamie, that you get your records from MICR. Perfect. I just wanted to point out, if for some reason, though, that you are not able to get your immunization records from your state registries, you need to contact your hospitals. You need to get your key corporate people, leadership people, or whatever set up to discuss how to get ease of those records in case that hasn't already happened, which I would think this day and age that should not be an issue anymore. All right. Well, we couldn't leave this without talking a little bit about quality improvement, right? The immunization quality improvement projects, they should be done. They should be part of your QAPI program. And you might want to consider a project that generates measurable increases in adult vaccination coverage with influenza, pneumococcal, COVID, or you might even want to consider a project that reduces disparities in vaccination coverage. So whether it's associated with race, type of health insurance, anything that's resulting in less than optimal coverage. Next slide. So you implemented your immunization process plan. You got your culture going, but you're not meeting your measurement goals. So what did you observe during implementation? Maybe one or more of these barriers is hindering your outcomes. You might be having a physical issue, maybe unable to obtain supplies or provide a clinic. Psychological psychological barriers. So hesitancy, we know that's a big issue right now. But there are also system-based barriers, and several studies have shown that eliminating missed opportunities can increase vaccination coverage by 20%. So think about this. Are you missing your opportunities because of maybe you're unaware that the person needs a vaccine? Maybe providers are following invalid contraindications. Maybe you have restrictive policies. These are all system-based issues. And if you identify any of these, go back, change one thing, just one thing, see if it works and see if you start to meet your goals or if they start to get better. As we mentioned earlier, building a culture of positive immunization, it's not going to be easy. It's going to take time. It's going to take commitment, but the benefits of healthy residents and staff, it's a win-win situation for everyone involved. So we only have a minute left. And so we weren't able to get to our last question, which, darn it, be honest with you, this was the big one that I wanted to talk about, because I find that it's going to be hard. It's going to be really hard to promote a positive culture when you have staff that have opposing views. You know, how do you deal with that? What do you say? How do you enforce? Enforce never works, right? That doesn't seem like a good word to use. So think about that. Think about what you may need or not need to do in regards to creating a positive culture and a consistent positive message at the same time. What to do with those opposing views of staff. And I have a couple of more resources here for you. The first one is actually a great resource. I use this one all the time. Please take a look at it. Resources for increasing staff and resident rates. And then the immunization strategies for healthcare practices. That is where we got a lot of our material from. So please take a look at that. All right, so that brings us to the end of our presentation. I know that the survey has been dropped into chat. So before you leave, could you please fill that out for us? We'd appreciate it. And if you ever do want to continue this conversation, on the in the slide, a couple slides above, you have our email addresses if you'd like to follow up, and you put a few comments in there, or if you have any other questions. So it's 2:01. I want to thank all of you for being here with us today. I appreciate also the Superior Health team being here to support our efforts. So everyone take care and have a great afternoon. Bye-bye.